Good day, good afternoon, good evening, wherever you are in your part of the world. This is King B News and Views with another video. This video is about bird flu. This is going to be an update to my previous videos. I've been following this story. So if you haven't watched those videos, please do go back, check my previous videos out that I have on bird flu. If you're not subscribed, please do subscribe to this channel. Click the notification bell. Every time I release a new video, you will be notified. And please do like and share. Leave a comment. Let me know what you think. Help get this information out in the algorithm. So you see the title on the screen. CDC reports third person infected in the U.S. bird flu outbreak, this time with the new symptom. So we have a third person in the U.S. who has contracted bird flu, and they're showing new symptoms. Right? So let's dig into this article, see what it's talking about. This article was released by NBC News 3 days ago. So another human case of bird flu linked to sick dairy cows has been detected in Michigan, marking the third farm worker diagnosed with the illness in the United States since March, the Centers for Disease Control and Prevention reported Thursday. None of the cases are connected. This is the second farm worker in Michigan in a week to be diagnosed with the illness, and the dairy worker in Texas was diagnosed in March. In those cases, the patient's only sign of illness was pink eye or conjunctivitis. So hold on a second. So this a second farm worker in Michigan in the week, and they're saying, or they're claiming that it's not connected. I find that interesting. Let's continue. This latest case is different, however, because the patient also had upper respiratory symptoms, including sore throat, cough, and congestion. So before, the only signs in the patients were of the illness, they had pink eye. Now this third individual have sore throat, cough, and congestion symptoms. During a media briefing Thursday, Dr. Nirav Shah, the CDC's principal deputy director, said there's no indication yet that the virus, an A strain of influenza called H5N1, is spreading from person to person, although the risk does not increase, or rather, although the risk does increase with respiratory symptoms. So they're saying that there's no indication of it spreading, of H5N1 spreading from person to person, but there's the risk increase with new respiratory symptoms. It looks like that's where it's headed. I've mentioned this and I've talked about this in the previous videos I've reported on this H5N1 strain. And please do know that they have different strains. Notice they're calling this strain the A strain. They have different strains of this bird flu. All right, remember there was a woman in China that was reported, or in Asia, who contracted two different versions or two different strains of bird flu. So they have different strains. Simply put, someone who's coughing may be more likely to transmit the virus than someone who has an eye infection like conjunctivitis. So basically, he's saying there's no indication, but really what he's saying is with these new symptoms of sore throat, cough, and congestion, someone cough, they don't cover their mouth or whatever, or they don't wash their hands, they cough in their hands, they touch something, whatever, you know, it can spread. The CDC is performing genetic testing on samples of the virus taken from the patient to look for changes that would indicate whether it's mutating in ways that would allow it to be more transmissible. Those results could be available within days. Now, this is just my personal opinion. I've said this before in my previous videos on bird flu. I mean, I most definitely think there's going to be that it's mutating, you know, and I believe they got their hand in it. You know, that's my personal opinion. This is something that could be very well could be created in the lab. You know, so it can mutate and go from birds to other animals like cows. There was a report of a goat, polar bears, you know, other animals contracting bird flu, and now people, right? The latest patient also had eye discomfort and watery eyes, but it was unclear whether the person had been diagnosed with pink eye. Like in the previous cases, the patient was given Tamiflu and was reportedly recovering. Dr. Natasha Bagdasarian, Chief Medical Executive for the Michigan Department of Health and Human Services, said that neither of the sickened Michigan workers have been wearing full personal protective equipment or PPE when they became infected. With the first case in Michigan, eye symptoms occurred after a direct splash of infected milk to the eye. With this case, respiratory symptoms occurred after direct exposure to an infected cow, Dr. Samian wrote in the press announcement. PPE is an important tool in preventing spread. So now my question is this. What are they doing with the cows that are infected with bird flu? What are they doing with the milk that is collected from the cows? That's my question, because I know recently, and I've done a video on this as well, where they ordered a large number of chickens to be culled or or destroyed. I believe that it's in the millions. I've done a video on this, so if go back to my previous videos. That's another video I reported on. You know, but that's my question. What are they doing with these cows? You know, I believe the number of the chickens was I think it was like 4 million chickens. About 4 million million chickens. I'm not certain on the number, but I did a video on it. So again, go back to my previous video on that. The governor, and I don't remember the state right now off the top of my head, but I did a video on it. So check my previous video, check that video out as well. But what are they doing? My question again, what are they doing with the cows? What are they doing with the milk? See, we live in a moment where we really have to be careful. You know, we're going to the stores and buying milk and buying eggs and buying beef, and we're feeding this to our families. You know, and also the rising inflation. You see the prices in the stores, right? You know, and then again, where if they're not sending this milk and not sending the infected cows to market, then where all this meat coming from? You know, when you think about all of the stores, grocery stores, supermarkets, to restaurants. You know, you got new restaurants popping up and food trucks, you name it. When you look at it in its totality, all of that meat, where all that meat coming from? You know, you have to start questioning that. Is the meat really, is it all beef, 100% beef? You know, I remember Wendy's promoted that they was using 100% all beef, but not every restaurant does. You know, you got to really be careful, right? Because because they're mixing um, they're mixing beef with other types of meat. You know, you know, and but more on that, you got to look. There was a video. There was a video that was released that I watched some years ago of a rabbi, Abraham Finkelstein, I believe his name is, did an interview where he was talking about how they mix human meat with, with the animal meat and then send it out to market. And he claimed, allegedly, one of the restaurants they send the meat to, McDonald's. The breakfast sausages and the hamburgers. Okay. I just came across someone posted a clip of a part of his interview, and I just came across this. So maybe that's why I'm bringing this up. And I don't believe McDonald's ever came out and said anything about those claims. At least I don't remember that. So basically, what I'm saying is a lot of the truth that's coming out right now is really due to social media. But none of this is new. A lot of these issues, a lot of what's going on been going on for a very long time. Just that we didn't have social media back in the day like we do now. So again, where all this meat coming from? When you go to these restaurants and when you go to the supermarket, you're buying your food, do people even care? You probably have some people out there that don't even care. As long as you got some real meat eaters out there. As long as they got meat on their plate, they don't care where the meat coming from. As long as they got meat on their plate and it tastes good, they're gonna eat it. But there are people out there who do care, and that's why people such as myself and others are put out videos like this. But let's continue with this article, But again, I just find it interesting that she's stressing PPE is important. They should be wearing PPE when they milking the cows and working with the cows and whatever have you. But are they still sending that milk and sending it to market, or those cows to market, to the slaughterhouses for market? That's my question. What are they doing with the cows? Okay, all of the farm workers at this latest Michigan dairy are being monitored for symptoms. The CDC recommended that anyone who comes into contact with a sick cow watch for symptoms for 10 days. As many as 67 herds in 9 states have been affected, according to the U.S. Agriculture Department. In addition to herds in Michigan, dairy cattle in Colorado, Kansas, Idaho, New Mexico, North Carolina, Ohio, South Dakota, and Texas have also tested positive for bird flu. Now, that's a lot of cattle. Look at all those different states. Given the extent of the spread of this virus in dairy cows, additional human cases in people with higher risk exposures would not be surprising, the CDC said in a press release. So they're expecting human cases to rise, right? As well as these new symptoms. This is expected. They expected this. They know this, or they knew this ahead of time. But yet they still telling people, "Oh, don't worry." Like there's a report about milk, cow milk, that they found strains of the bird flu in the cow milk, but yet they were saying that they was telling people not to worry. What do you mean, don't worry? I mean, we really have to pay attention to what's going on. Seriously. Maybe it's time to really start questioning what we eat and changing what we eat. You know, our eating habits. You know. All right. Federal health officials said that the risk of bird flu to the general public remains low, and that their focus continues to be on the potential risk among dairy workers. I mean, that right there. Of course, the federal health officials, of course they're going to say that. Oh no, it's for the public is low, nothing to worry about, nothing to be concerned about. It's just the concern is just and the risk is just among dairy workers. Really? If you got somebody showing symptoms of new symptoms of coughing and congestion, isn't that how it spreads? You know, are you telling me this? You know, these individuals don't leave the farms? You know, they don't go around other people. I mean, come on. We should remain alert, not be alarmed, Shah said. The CDC said that its influenza surveillance systems have not picked up any unusual flu activity. Preparing doses of bird flu vaccine, and here we go. Isn't that the goal? New vaccine. The Department of Health and Human Services previously said that the government had started the fill and finish process of about 4.8 million doses of a bird flu vaccine. That process is likely to last until later this summer, said David Boucher, Director of Infectious Diseases Preparedness at HHS Administration for Strategic Preparedness and Response. At that point, the Food and Drug Administration would have to consider whether it is necessary to authorize such a vaccine. Boucher said it would be premature to speculate on who might be first in line for the shots. This is the fourth case of H5N1 overall in the U.S. An inmate in Colorado who had been working on a farm culling birds, suspected to be infected with bird flu, was diagnosed in 2022. His only symptom was fatigue. Globally, less than 1,000 cases of H5N1 in humans have been identified. CDC data shows that more than half of those patients died, but that death rate may be an overestimate as mild cases may go undetected. The CDC recommends that anyone in contact with dairy cattle, including bedding and animal feces, wear protective equipment including safety glasses, waterproof aprons, and boots that can be sanitized. The agency also said that people should not drink unpasteurized raw milk. Yeah, that's and speaking of which, the article I've read, and I did a video on that, on the milk, they said the pasteurization process supposedly kills the virus. You know, but I stopped drinking milk, and I don't milk and anything from an animal years ago. You know, and I remember when I was still eating meat and using milk for dishes. You know, when I would cook, I remember buying milk at the store and, and then checking the date, making sure the milk was still good, bring the milk home, open it up that day and smell it, and smelling this real foul odor coming from the milk, and it was one of the reasons why I said, I definitely need to go back to being vegan. And that's what I did. That was one of the reasons. It was this real bad odor. And then check the date. Well, the date is still good. But in a lot of these stores, what they do is You got food that go bad, they take it in the back, they change the date, put a new date on it. You know, just like with the meat start to go bad and you know, and start to get brown, especially with the so-called beef, and they just take it in the back and open it up, mix it with blood, and then, you know, to give it that red color, and repackage it, slap a new sticker on it, and put it back out on the shelves for people to buy. Now I know plenty of times I done, you know, picked up and bought a pack of steak or some ground beef. You know, you look at it, make sure it got that nice red color to it. I get it home, open it up, and once I take the meat out the package, underneath the meat is all brown. That's because they took it, mixed it up, mixed it with blood, and then repackage it. You know, and once they repackage it, they got to put a new sticker on it so it gets a new date on the sticker, a Best Buy date. You know, and I remember having a conversation with the individual who was a co-worker of mine back in the day, who used to work in stores, and told me that's what they do, because he used to do it. You know. So, again, you have to really be careful. For those of you out there listening to this video, you really have to take all of this information into consideration and really start thinking about, is it time to change your eating habits or what you eat? You know, this is something that you really need to be paying attention to and monitoring, right? Very, very interesting. But again, check out my previous videos. This is a case, a story that I have been following, and I have videos on this subject. So check those videos out. Again, if you're not subscribed to the channel, please do subscribe. I have videos with some good, valuable information that you need to know. Share these videos, like and share the videos, help get this information out there, because more people need to know about what's going on in our society, what we're dealing with, what we have to deal with, and how we need to prepare ourselves. All right. Shout out to my subscribers. I appreciate each and every one of you. Thank you for tuning in and watching this video. This is King B News and Views, and as always, love yourself unconditionally. Keep your loved ones close, and prepare. Do the best you can. Do the best you can. If you are a part of a group, make sure you talk, have meetings, talk about your plans. You know, everybody is continuing to do their part. You stay ready, so whatever circumstances you may have to deal with, you can deal with it. You're prepared, right? Remember to protect the children and our babies. Our babies are under attack, as well as our women. Shout out to all the natural-born women out there, right? And for those of you, if you are by yourself, you're not a part of a group, you're by yourself, don't be alarmed. You still can prepare. You still can prepare. Just do the best you can. Stay informed and do the best that you can with what you have. If you living inside of an apartment, you renting an apartment, you still can grow your own food. It's not impossible. You can get you some 10-gallon buckets and get you some soil, and you get your seeds, and you can grow your own food. Or they got these grow bags. You can order some grow bags, which are inexpensive, and grow your own food. You know, you're not, you know, it's not a hopeless situation if you by yourself and you live in an apartment. You still can grow your own food. Okay? But this is what this channel is about for the people who are watching this video, and you know, and you're not subscribed. Check out my previous videos. I will see you all. You'll hear from me in the next video. Have a great day. All right? This is King B News and Views. I'm out. Peace.